So 4 years ago yesterday, I was diagnosed with inoperable stage 4 cancer. At that time, my doctors gave me probably 2 years to live. My cancer carried a mutation with an uncommon insertion, and that's a lot of technology you don't need to worry about, and it had already spread to my brain. There were no FDA-approved treatments capable of treating my brain metastases for my specific insertion. My options were pretty bleak at that time. I am alive today for one reason: a clinical trial drug that has kept both my cancer and my brain metastases at bay and has given me the gift of life for 3 years. But even that lifeline is now ending. The trial that has kept me alive has been defunded, and the remaining supply of drug will soon expire. I am now finding myself once again forced to find a new treatment option and hoping something becomes available in the time that I have. These trials exist because of the very funding that Orden and Tiffany voted to cut. My experience is not unique. I belong to a small support group that had 12 members just a year ago. In the last 5 months of 2025, we lost 4 of them. Of the 8 who remain, more than half of us are now struggling to find treatment options that can treat our specific mutations and metastatic involvement. For patients like us, research is not an abstract concept. It is the difference between life and death. And yet, Derek Van Orden and Tom Tiffany have repeatedly voted for cuts for the very funding that keep patients like me alive. Cuts to medical research will not be measured in dollars. They will be measured in human lives. Today, 39%, more than a third of Americans, will be diagnosed with some form of cancer in their lifetime. The breakthroughs that save lives do not appear overnight. They come from decades of sustained funding, scientific collaboration, and the willingness to keep pushing. My survival is proof of what happens when that system works. The losses to my support group are a reminder of what happens when it doesn't. As discussions about healthcare and research funding continue, I ask policymakers and the public to remember that behind every statistic is a family, a community, and the future depends on innovation and research. The cost of cutting the research is not theoretical. The cost is real, and it is human lives. Thank you.